Okay, so Nutcracker, let's start. So last seminar, Nutcracker treatment. So as I said before, the Nutcracker symptoms arise from main two categories. One is left renal vein hypertension related symptoms like hematuria, proteinuria, left flank pain, and many other various symptoms are related to the developing collateral vessels. So examples are various blood symptoms and pain in other area of the abdomen, and the pain or discomfort in various other parts like a headache, so tinnitus, nasal stuffiness, and edema. So the variety of symptoms can be related to Nutcracker syndrome, and also in postural variation session, I talked that for the Nutcracker patients, the best sleeping posture is left lateral decubitus, and the worst is the flat supine posture. And the right lateral decubitus is between left lateral decubitus and supine. So we usually recommend Nutcracker patients to have such a sleeping posture. First, start your sleep with a left lateral decubitus and hugging a long pillow. That may help you keep that lateral decubitus posture. But if you have this left lateral decubitus for a while, maybe you can feel some discomfort on your left shoulder, then you change it to the right lateral decubitus and change between the left and right lateral decubitus, and never have a flat supine posture, sleeping posture. And during daytime, is nowadays many people do computer work whole day in the sitting position, moving just a fingertip and no movement of this trunk. And for those people, if they have a Nutcracker, then recommend to leave this chair and stand up and raise the computer monitor, and maybe you can work with the body movement, like the working, working the working posture and doing the computer work. So that may help to the Nutcracker patient during the daytime. But some people said that they try to keep those left lateral or right lateral decubitus postures, but when they wake up, they have a supine or flat posture. And how can I do that? That they asked the question. Then my recommendation, the first recommendation is this one, using this small and a little bit hard, the pet, the bottle, and tie that bottle with a long string, and have this bottle on the back side of the patient and the string on the anterior chest, and tie it in the anterior chest and keep the pet bottle on the back side. But if you move, then in the morning, maybe you can this bottle will locate in the anterior chest. So in those patients using this pet bottle, and I recommend them to wear the costume, have this button in the anterior, and tie this end of the string to around that bottle, and fix it in the button, and probably it will be easier to keep this bottle on the back side. Then during the sleeping time, if the patient have the movement, then if they have a supine posture, then probably this bottle will wake up the patient, that warning that you are having the supine posture. So sometimes it's quite helpful to the patient, but the better way is like this one. This is a cycling the safety vest, very thin, this kind of vest, and tie the pet bottle, plastic bottle on the back side of this vest. And when you sleep, wear this vest, then probably you have this pet bottle on the back. And this will help you keep this lateral decubitus postures left to right and avoiding the supine posture. That is a very simple, but sometimes quite helpful to the patient. Then, so if the patient do their best to sleep in the lateral posture and avoid the immobile, for long time immobility during the daytime. But if the patient continuously have symptoms like a severe gross hematuria or the severe abdominal pain, that the patient is difficult to keep the usual normal life, then we consider the surgical procedure. There are various surgical procedures. There's vascular surgery, like the reimplantation or transposition of the left renal vein in another place of the inferior vena cava to escape from the severe compression in its normal position. And if the patient have a large left gonadal vein, then probably use this left gonadal vein reimplantation to the inferior vena cava may help drain the left renal venous flow to the inferior vena cava. Also, reduce the pelvic congestion. This is a very nice option if the patient have a severe nutcracker and the severe pelvic congestion and having the symptoms like flank pain and also pelvic pain, then this kind of surgery will be very helpful. If there is no suitable bypassing vessels, then maybe we can use like a saphenous venous bypass. So there are a lot of vascular surgeries, but these are very significant and major surgical, need a major surgical procedure. And sometimes patient can receive the auto-transplantation, remove the left kidney and transpose to the right pelvic cavity. So auto-transplantation is one option. And if the patient have a healthy right kidney and want to donate his or her problematic left kidney to the other people who need the renal transplantation, that is another option for the severe nutcracker patients. And for the non-surgical interventional procedure, the lightest option is a internal stent. We can easily put the metallic internal stent in this left renal vein, and it can help relieve the compression. But this patient need a lifetime anticoagulation, and that is one problem. And another problem is if this stent move to the inferior vena cava side, maybe it will be very difficult to remove this stent. So that is that can cause quite a serious problem. So nowadays we do not recommend this interstenting. Instead, nowadays we recommend the external stenting is like using the Gore-Tex, the artificial, the vessel, the material, and this is a paper that reported that robot-assisted extravascular stent for Nutcracker syndrome. This was a report in 2023, and this Nutcracker patient and exposed the left renal vein and wrapped this compressed part of the left renal vein. This external stent, it can help the patient if the patient had the severe Nutcracker symptoms. The one hospital now I'm working in, the urologist in the hospital is very much interested in this procedure. I started to do that, and now probably he did this external vascular stent about 15 patients, and he is now having quite a lot of experience. I will show you one example. This is a young woman. This patient had a large left adrenal cyst, so the surgery was planned, robot-assisted. The surgery was planned to remove this adrenal cyst, and CT shows this patient also has the Nutcracker, quite a severe Nutcracker phenomenon. And this patient had the Nutcracker symptoms, had a left flank pain and the bladder symptoms, and Doppler ultrasound shows Nutcracker phenomenon here, and the peak flow velocity is 149. And when the robot-assisted removal, after removal of this adrenal cyst, and the neurosurgeon did the extravascular stenting to this area to protect this left renal vein from severe compression. And this is a CT scan after surgery, and you can see the external stent material wrapping around the left renal vein between the aorta and the supraventricular artery. And color Doppler ultrasound shows the quite smooth movement of the left renal vein flow, and the peak flow velocity was quite lower than this preoperative study, now 74, about the half of the velocity from preoperative status. So, and also the patient symptoms like left flank pain and blood symptoms like frequency and nocturia was much improved after surgery. That is one example case of extravascular stent. Another patient, this is also a young woman, had a left adrenal small adenoma with Cushing syndrome, and the robot-assisted surgery was planned to remove this adrenal adenoma. And the CT shows this patient have a Nutcracker phenomenon type 2 compressed by the right renal artery, and the color Doppler ultrasound shows the jetting flow here, and the peak flow velocity is higher than 100, is 134, and also same surgery was done, extravascular stenting, and this is post-operative. We see the extravascular stent here, and the Doppler shows it is a smooth flow, and the peak flow velocity also about the half of this preoperative peak flow velocity. And also this the microhematuria and nocturia was improved in this patient. So this is quite the efficient, quite the convenient surgery. Those cases, this was not Nutcracker was not main purpose of this surgery, but because those patients has a problem in the left adrenal gland. But now the surgeon is doing this extravascular stent for just targeting the Nutcracker patient, and now getting experience about 15 cases. About half of those 15 patients after surgery, symptoms dramatically improved. And another half is a not dramatic improvement or was having a first a little bit improvement and recurred symptoms. So my impression is that this is another very grave surgery, and effective, but the relieving symptoms, it is not 100% effective. So we need to consider the fact, and we need more experience. And I will show you one example. Is a unlucky patient, young woman that had Nutcracker syndrome with gross hematuria, and had a persistent. This patient had a left kidney auto-transplantation and removed the left kidney and leave the transplant into the right pelvic cavity, and preoperatively had this tight nutcracker here, and this is a peak flow velocity. And after surgery, the patient gross hematuria was persistent, and the CT shows that the renal vein of this transplanted kidney is compressed around the external iliac artery. This is a vein, and this is the artery. And when Doppler ultrasound was done here, also the high peak flow velocity, and the venography shows that this is a transplanted kidney, auto-transplanted kidney, and this is a renal vein of this kidney, and there's the evidence of compression here, and so the balloon, the angioplasty was done, and this shows the waist here. And now waist is the relief and the ballooning. And this patient gross hematuria. And at the time, the pressure gradient across the here was a 4 millimeter mercury. And after this balloon dilatation, the patient gross hematuria was improved, but still this patient had a intermittent hematuria. So this was the example of complication at the auto-transplantation. So that is a very short introduction of the Nutcracker treatment. The first thing is a postural modification of the sleeping posture and daytime walking posture. And second is we can use some medication, and if it does not work, then and the symptom is severe, we can consider the surgical procedure, and also we can consider the external vascular stenting. Okay, so that is the end of my presentation.